So good morning, everyone. My name is Natasha Hartson. I'm the Director of Entrepreneurship and Innovation with Wood Buffalo Economic Development Corporation. Quite a mouthful. Excited today to have a great panel of safety experts. I think it's very indicative of Fort McMurray to be able to pull together so many experts in safety in one panel. So that's great. We have a culture of safety in this community, so I'm happy to have all of you here. We thought it was really important to continue this conversation of safety and re-entering your workplace and your businesses, and to continue that dialogue. We know that this is an ever-evolving situation for everybody involved, and so we hope today adds value to you. And if you want to ask questions of the panelists, please do so by putting them in the Q&A box. So down at the bottom of the screen, you'll see there's a question and answer or a chat. Please ask that you put your questions in the Q&A dialog box. The chat box sometimes can get a little busy, so preference is for the Q&A box. Other than that, everyone in the audience, I guess you could say, is muted this morning. So the panelists, though, are the only ones who will be able to speak out loud, but use that Q&A box. Other than that, that's it for me from the housekeeping side of things. I want to pass off to my colleague and co-host, Michelle Toner. She is the Executive Director of the Northeastern Aboriginal Business Association, also known as NAABA, and Michelle will introduce all the panelists. Thanks, Michelle.
Thanks, Natasha, and thank you, for mentioning our safety culture here in Fort McMurray. I am very proud to have two of our NAABA members as panelists today, along with our HR consultant that NAABA works with as well. So I will go through and give a brief description of who our panelists are before we kick it off with our first presentation to start this morning's event. So with us today, we have Deanne Bass, and she is an HR consultant with 15 plus, when she had 15 plus years of HR experience, she knew that she could help small to medium-sized business establish or improve their HR functions. And she founded Tenfold HR Solutions. She comes from a long line of entrepreneurs. She's been working on small business initiatives since she began helping run the family payroll while still in high school. So she thinks like an entrepreneur, and that really benefits her clients because she's able to focus on the true needs of business. She has her Bachelor of Commerce from the U of A and holds a certificate in labor relations through Queen's University Industrial Relations Center. She's a certified professional in human resources and is recognized as an SHRM SCP in the US as well. Next, we have Robin Villebrun. And Robin runs Medica North, which is a full member of NAABA, Aboriginally owned and controlled. She's a member of the Athabasca Chippewan First Nation from Fort Chippewan here in the region of Wood Buffalo. She's a passionate RN and entrepreneur. And her company, Medica North, offers drug and alcohol testing, health screening, health surveillance, and workplace wellness programs. She comes into occupational health with an extensive background, starting off as an RN in the hub of the oil sands at Suncor. Medica North's mission is to support employers in creating healthy employees and safe working environments through quality services, strategic planning, and comprehensive programs. So definitely has some great insight to share with us today. Also on the line, we have Tim Gondek, and he is the Division Director of Oil Sands at Safety Energy Canada. Energy Safety Canada. It's the nation's oil and gas safety association. Their goal is the same as industries: zero injuries, zero incidents. They work side by side with industry to drive safe work performance. Tim has more than 30 years experience in the safety industry and has led teams in the area of emergency services, emergency preparedness, occupational health, industrial hygiene, safety, risk management, radiation safety, quality programs, and training. So welcome to Tim as well. I'm sure lots of great insight for everyone here today. Next, we have Bernie George, and Bernie is the Director of Health, Safety, and Training with Boucher, also a full NAABA member. He has 30 plus years of operation and maintenance experience from mining, utilities, oil and gas sectors that complement his health, safety, and environment expertise. Of those 30 years, he has specialized in HSE and training management for 14 years. Bernie has an extensive certification background, OH&S and CSO, and a trainer of confined space, fall protection, elevated work platform, advanced bear awareness, HSE key leadership, and several other industrial courses. He has a passion for safety, but also for his family, dogs, motorcycles, snowmobiling. I don't know when you have the time, Bernie, but it looks like you make it work. He does really value safety in the workplace, and we're very happy to have him here. And then finally, from the government of Alberta, we have Vanessa Cheeseman, and many of you have been on these calls, are probably familiar with Vanessa. She is in a new role with stakeholder relations for the pandemic response planning team of the government of Alberta. So she is working with the province, the Department of Health, and alongside municipalities to manage the impacts of COVID, and she can explain a little bit further her role on this response team. So we'll kick it back to Natasha, who's going to have Vanessa start her presentation.
Great. Yeah, sorry, I forgot to mention at the beginning of the call, sort of the flow of this will be Vanessa's going to do a brief presentation for everyone, and then we'll open up to the question and answer. So Vanessa, are you ready? I know we've been having some technical difficulties, so are you good to go?
Can you hear me?
Yes, not too. Your sound isn't super great, so keep near your microphone if you can. If you want to, are you ready for me to share the screen and go?
This one. Yep. Yep, go ahead.
All right, let's see here. All right. Share.
So good morning, everybody, and thanks for having me. And it's good to be kind of back in the NWB doing some work. I've been working with the pandemic response team and the PRPT, or pandemic response planning team. So what we do is we look after the long-term planning and relaunch plans for the government of Alberta and its phases back into relaunch. I'll go into the next slide, Natasha. And so basically today I'll just kind of give a very brief overview. I am by no means the safety expert on this call. So when it comes to relaunch, I am very familiar with a lot of the documents and the rules and guidance for that. So some of the overarching direction are the CMOH orders. So the CMOH orders are law abiding that you have to abide by. So 50 people maximum for indoor social gatherings, including weddings and funerals, the 100 people maximum for outdoor events and indoor seated audience. And there's no cap on number of people for public health measures in place for places of worship gatherings, restaurants, cafes, casinos, and bingo halls. Now, all the orders can be found at that address, but why is it important as an employer to know these rules and these overarching CMOH orders? Is because as an employer, you have people coming into your business, you have employees that are going to be leaving the country, possibly coming back in. You have to be aware that, you know, if you have an employee coming in, they have to self-isolate coming back into the country. They won't be able to come back to work. So those are some of the things that you have to think about as an employer and safety for your company going into relaunch and going into this stage 2. Yeah, next slide. So some of the online supports, I'm sure you guys are all very much aware of Biz Connect, and I guess a little background of Biz Connect. It was started as an email address by our team, and it just kind of took off. It was, you know, became a very central location for information in terms of relaunch guidance and documents and whatnot. So we've seen kind of explosive growth with this Biz Connect and how it's used. So you can send emails to Biz Connect, but if you go on alberta.ca/biz-connect, that's where you will find all of the up-to-date, like everything that comes from the health minister, from Dr. Hinshaw, it will go to Biz Connect first. So that will be your first spot to look for any up-to-date guidance. Next. All right, so some of the documents you're going to find on Biz Connect that are going to be very useful in terms of safety for your company and Relaunch are just going to be general guidance. This will give you a very general overview of what the expectations are from the province in terms of Relaunch. There's infection prevention and control documents that will help you go through what can you do as a business, as a company, as an organization to help protect your customers and your employees. You have the OH&S resources, and that's everything from if you are taking someone back part-time, if you need to do layoffs due to COVID, etc. There's lots of resources on there. The flushing of water systems if you haven't been in your building for a long time, and at this point most people are probably after doing most of that. The masks for non-medical, so there's documents on there of what situations you would need to use a mask in. The public health orders that I just spoke of, so what are you legally responsible for doing in those public health orders? And then there's posters available that you can print off for your company and your organization that you can put in your business. And that's everything from one person in the washroom to 2 people in the washroom, etc. Just to give guidance to your employees and to the public that might be coming into your business. So you can access the posters from that website. So the info, this is also on the Biz Connect website. So info on Relaunch financial support. So there's Relaunch funding coming soon. You can click on all of these, but these are all financial supports that are available that are COVID related, and that might help you re-enter or relaunch your business maybe a little bit sooner or give you some financial assistance due to COVID. And then we have the personal protective equipment, the PPE. So business owners should conduct a hazard assessment to identify existing and potential hazards. So when you're going back into your business, when is a time that your employees might need a mask? When will the public need a mask coming into your business? So doing those hazard assessments will identify some of those PPE requirements that you might have. So the government is prioritizing distribution of PPE to critical services. So hospital workers, first responders, homeless shelters, and senior centers will be getting priority in terms of the N95 and any masks that are coming in. But as a business, if you are looking for PPE, go to the next one, Natasha. If you are looking for PPE, on the bottom of the Biz Connect webpage, there are resources there. There's these links to these organizations that you can request. So what they do is they source PPE for companies. So if you're having a hard time finding PPE or you don't know a distributor or whatnot, there are links to these companies that can help with distribution. The government is not responsible for the prices of these products. Right now, it is consumer demand that will be driving some of the costs or the quality. So you do have to do some of that back check for yourself and ensure that you're finding the masks that you need for your company. So these are some of the resources. That's the website again that I just went over and where all of these resources are available. So it's alberta.ca/bizconnect. You'll find the relaunch template for business there, workplace guidance documents, and then other current documents. There's the Biz Connect website for questions that impact individual enterprises. So if you have an individual company and you have a specific question about how can I do this or what can I do, you can send an email there. We also have the PRPT stakeholders government of Alberta, and that would be myself and my team. So if you have any inquiries that are general to nature impacts like municipal issues. So if you have an organization, we typically answer questions, and I'm obviously open to answering questions today and follow up that you may have. So yeah, thank you guys. Sorry, my video.
No worries. Thanks, Vanessa. That was a good way to kick it off and give everybody resources. Vanessa, will we be able to share those slides if I put them in PDF and send them out? That's all right? Okay, perfect. So we'll send those out to the group after. So there was a number of links in there. So hopefully you can click and go. Well, thank you very much, Vanessa. I think that was a good kickoff. And so now let's turn it over to the panel discussion. Oh, there your video works, of course. Awesome. So what I will do is I'll pass it back to Michelle, and she's going to kick it off with one of our first questions today.
Perfect. Thanks for that, Vanessa. Okay, so our first question we're going to pose to Robin. And to kind of set the groundwork, as we've progressed through the COVID-19 pandemic, symptoms and the subsequent actions to take once they have appeared have changed. So some things that were originally indicated as symptoms may not have been so serious at this point. Can you review with us the major symptoms of COVID-19 and what an employee should do if they find themselves presenting with any of these symptoms?
Yeah, for sure. Well, they say that studies have shown to date that it can present itself merely as like a common cold to severe respiratory symptoms like in SARS, which is the severe acute respiratory syndrome. That's why the virus is called SARS-CoV-2. But to answer the question, what are the current symptoms to date and the signs? You're just looking at your basic coughing, fever over 38 degrees. You know, our normal body temperature is between 36.1 and 37.6, depending on what route you're taking that temperature, of course. But it also can cause like general body malaise, which is your extreme tiredness, fatigue, soreness, runny nose, sore throat. Sometimes accompanying with that sore throat is like painful swallowing, basically just overall exhaustion. Some of the other findings that they're noticing are, and with data like the months past and the data gathered, is GI symptoms. So your gastrointestinal, nausea, vomiting, diarrhea, taste, loss of appetite, taste or smell. And the latest is conjunctivitis, which is pink eye. Some more serious attack on, I guess, on your respiratory system includes shortness of breath and pneumonia. So your other question was, what should employers do if they find themselves presenting with these symptoms?
Yeah, so if you're at home and you're kind of starting to not feel so great, or you think, oh, I have a stomach, or things, the conversations you should be having in your own head before you attempt to go to work.
For sure. So like as an occupational health nurse, we're kind of all about proactive approaches and, in the health business. So I wanted to ensure like businesses and companies are mitigating the risks in employees' behaviors and practices surrounding infection control prior to finding themselves presenting with symptoms. I would suggest establishing, like for companies as well, a health and safety committee and have a professional health advisor to assist them in these hazard controls like Vanessa was talking about. And, just especially with our upcoming flu season as well, it's going to kind of be like a double hit almost. We're kind of going into the stage 2 of things, but we're kind of just starting to prepare as occupational health nurses for flu season as well. So you just want to look at preventative measures. We should be in the planning and implementation stage, but if an employee finds themselves with influenza-like illnesses or COVID-19 symptoms, they should first immediately self-isolate. The Alberta Health Services has tons of documentation on their website about the kind of rules around that. There is legal action to be taken if you find yourself with a positive test and so stuff like that. So yeah, so number 1, just self-isolate. Number 2, I would probably suggest completing the online self-assessment tool, and that will kind of direct you to what next steps should I take. They're very strict about leaving your property during your period of self-isolation, which is usually I think it's 10 days right now. They switched it. It used to be 14 and now it's 10. The last thing is call your employer. Employers should have like their sick line set up, and I would always recommend that employers should structure a call tree just to track and locate where the worker was at the time, document it, encourage them to utilize the Alberta Health Screening tool, you can go online there and go to your online booking, and it'll provide direction through the online self-assessment tool, and then tell you where you should go from there.
Yeah, that's great. No, I think that's a perfect start. Yeah, I'm sure we'll get further into the details as we continue through. Yeah, so I guess the next question then would be, Bernie, as a safety officer, where do you even begin to assess the risks for your employees and your customers as it pertains to COVID-19?
First of all, I'd like to thank everybody for inviting Boucher into this conversation here today. We're a very proud member of NAABA and a big supporter of the community, so we really appreciate the opportunity. For us, basically, we started right at the basics, and that's with Alberta Health Services. An important thing for us was communication and proper information to our people. One real downfall of this whole situation has been social media. People are on social media, you hear the worst horror stories that you could possibly hear, and then you hear other people saying that it's a big farce and it's not even real. The important thing is to have accurate information to your employees and have open lines of communication. So what we did as a company is, again, we started at the basics. We started with the Alberta Health Services questions to all of our employees, and then we went a little bit further and we delved into whether people had underlying health conditions, whether they were living with people or had close family members with underlying health conditions. There was a lot of scared people out there, and if you look at the statistical information of the deaths across the world, a lot of it is related to our elderly people and to people with underlying health conditions. So basically, again, we start at the basics. We do our questionnaires. There's the physicality of things as far as setting your office buildings up for common areas and for one-way traffic or physical distancing or social distancing of 6 or 8 feet, whatever the case may be. So that's kind of where we started with. And then as we went through this, we got a lot of questions. So that open line of communication where people would say, well, what about this? Or what if that happens? Or what if this happens? Or what if I have the sniffles? Or what if I have hay fever was a big one. So people with allergies, and they say, well, I've got allergies. And you know, they do the self-assessment online, and then they find out that it's not worsening of an existing condition, but it can be a little bit interpretable. So for us, again, the open lines of communication, we had one designated person that was doing the communicating with our entire group. I thought that was really important. And then we had people that were actually doing the research and staying away from the news, staying away from social media, and getting our information from the experts, which was basically Alberta Health Services.
Great. So do you want to expand a little bit about some of the things that Boucher has done? So as an office building, in terms of common spaces, stairwells, elevators, some of those things that, you know, it might not be front of mind for somebody who works in an office space that doesn't have a set safety person, but that you as an expert would say, oh, you know, this is kind of one of the areas that we really need to concentrate on?
Yeah, certainly. So the conference room I'm sitting in here right now can house probably comfortably 16 or 18 people easily around our conference table. We can put 5 people in this conference room right now. We have chairs only at the places where we can sit. We have O's on the table where we can sit, and we have X's in the places that we can't. All the other chairs are removed, and we have signage when you come in here that it's got an occupancy of 5 people. There is cleaning supplies that are here on the table and in all of our common areas that you're required to clean before you come in, or as you come in and before you leave. For areas like lunchrooms and common areas like that, we have one way in, one way out, so people aren't kind of meeting in the middle. We have occupancy requirements for our lunchroom as well. Downstairs, for an example, on our 3rd floor, there's only 4 people allowed in the lunchroom at a time, and we have it set up so those people will stay more than 6 feet apart at all times. For areas like our elevator, we did the same thing. We have notices up in our elevator. For us, we can't maintain 6 feet of distance in our elevator. So the requirement for us is you must wear a mask as you come into the building and enter the elevator. And once you get off the elevator and you're into the common areas where we do have the lines up for physical or social distancing, you can remove the mask, but inside the elevator itself, you have to wear it. There's O's again on the floor of the elevator where you can stand, and X's where you shouldn't, and 2 people in the elevator at a time. Bathrooms, the same way. We have notices up on our bathrooms saying how many people are allowed in there at a time, which is in ours is just 2. And it's that positive reinforcement. And we make mistakes. We're human beings. We forget. We walk the wrong way. So it's that positive intervention when we're respectfully speaking to people, saying, "Hey, can I talk to you for a second?" And that seems to have stead us very well.
Okay, and what about, Bernie, cubicles?
So the cubicles.
Would it be an expectation that people working in cubicles would have to wear masks if, you know, they're back to back kind of thing?
That's a really good question. So when we were down at RCC, we went down to the center down there, and we took a look around, and we have cubicles ourselves. And what we do is we have markings on our floor, so people cannot actually enter your cubicle without having a mask on, right? And so there's that 6-foot clearance that people can sit at cubicles. If they're sitting back to back and they're 6 feet apart, what we've done, and we've had the luxury of moving some people, but where we can't, is that we would expect people to wear the masks as they came into their workstations. When they sat down, if they were back to back, generally there's about 6 feet in between you. We wouldn't require somebody to wear a mask at that time. However, in our buildings, we always have to have our masks on us. So we'd have it on your arm or have it around your neck in case, like, you're going up a stairwell and there's other people that access our building, and you can just kind of flip that on in case somebody gets into your personal space.
Okay, great. So I'm going to kick it over to Robin now to talk a little bit about masks and gloves. Oh, sorry. Masks have been very hot topics, and, you know, Bernie has referenced social media and some of the criticisms of people wearing masks, people who aren't wearing masks, how people are wearing masks. Could you give us a little bit of some tips about when they should be used, when they shouldn't be used, and where we're seeing the gaps or inappropriate use? So how can people really be using masks effectively and efficiently, and how can we improve on how they're being used right now? So I'm going to throw that over to Robin. Oh, you're muted, Robin.
I think it's basically all about, you know, again, educating the public. This is a whole new kind of global pandemic thing for the entire world. So we're all just getting, you know, understanding what types of masks are out there, you know. So if you break it down into, let's just say 3 main masks that we see in the general population, you got your medical mask, which is similar to this one here. And then you have your cloth fabric covering mat, like homemade mask, I guess. What, Bernie, was that a homemade one? Yeah, so something like that. And then you have your N95s. So the difference between like them is like, I would like to tell people is like to educate yourself, you know, when to wear them and where to wear them. Like the medical covering masks, like the one I have here, we use this in our clinic because we know that there is not a direct exposure to COVID virus. We're not like in a healthcare facility where, you know, the nurse is going to go into this COVID patient's room. You must have the proper PPE. N95s are certified NIOSH tested masks. They are meant for our frontline healthcare professionals and stuff like that, where you know the known hazard exists. Where we're in office buildings, you know, there's a possibility. You go into a grocery store, possibility, right? Fabric masks, they are good. As an occupational health nurse, this is something new for me to get used to because we were always taught that it either needs to be certified, Health Canada approved, and blah, 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 right? Whereas now the government is saying like just any kind of facial covering is good. It sometimes with the fabric homemade masks, it can provide a false sense of like security and maybe a less disciplined practice surrounding physical distancing as well. So, you know, I just wanted to make it known that they are recommended now by our government, but if you can have a Health Canada approved mask, I would recommend that. along with these medical covering, these ones here, some of them, they come in different forms, right? Some of them are fluid resistant, some of them aren't, some of them are breathable, some of them aren't. So you just want to make sure that you're wearing a mask that fits your face and your breathing. Anytime you don any kind of facial covering, it is going to put extra cardiopulmonary effort on your system. So if you have any underlying, medical conditions, you need to be aware of that, because it can exacerbate like your hypertension, or if there's any cardiovascular disease involved and stuff like that. So you want to make sure, like at Medica, what we do is we do a fit to wear respiratory equipment questionnaire prior to anybody donning a mask in our clinic and being tested in a quantitative manner. So what that basically does, it deems the person free from any physiological or psychological effects prior to actually wearing a mask. And so people don't actually know this, right? So, but it is the Alberta Occupational Health Code as well. But, with the N95, like I said, hospitals, that's what they're for. Masks are meant to just protect the other people from our aerosols and vape, like everything coming out of our mouth, and that's essentially what they're for.
Okay. Would you say, could you comment on people taking them on and off, and some of the things surrounding it, you see them, people have them around their neck, or they take them off to talk.
Yeah.
On, and what are your thoughts on some of those situations that we've been seeing, wearing them in a car or wearing them at the grocery store?
Like there's a whole education piece behind masks, and I haven't really looked into the documentation given to us by our government on certain sites, but when you don and doff a mask, there definitely is a procedure for that. You should always, either wash your hands for the 20 seconds prior, or use sanitizer before touching it, and then again when you take it off. It should be kept in a kind of like a dry, clean location. A lot of people are shoving their masks into plastic bags, and after wearing them all day, or for a couple of hours, or even for a grocery store run, there's moisture inside that mask, right? So sometimes especially the man-made, like the homemade cloth masks, microorganisms can start to grow in there. And then imagine that, putting that into a little breeding ground of a plastic bag. And so there is procedures around that. You have to clean your mask if it's homemade every day. Medical masks are meant to be like a one-time use. N95s, it depends on the type of N95. Does it have a valve? Does it not have a valve? How much physical activity is the wearer doing while using the mask can make a big difference, because we're exhaling and inhaling inside there. So yeah.
So you answered my next question already, talking about checks and balances, which is great to put in place. It was for you, but Deanne, there's been some, sorry, go ahead.
For the checks and balances, the question, is that surrounding just the masks, or is it surrounding like the overall?
In general, we were saying, like, what are some checks and balances to put in place in terms of for your employees before they get on site? So if you want to elaborate on that, by all means. You did mention, doing self-screening and self-isolation. Are there some other ones that you would recommend to people on the line? They're saying, like, make sure that people are doing that piece.
Yeah, I think I do have a little bit to say about the checks and balances, but like any part of planning for your hazard assessment, I think Vanessa touched on that as well. What you want to understand is that COVID-19 is a biological hazard and at a potential risk, considering that we are in a global pandemic. So you just kind of want to look at all aspects of that hazard. You want to begin to assess the risk, apply the controls, do the job planning like Bernie spoke about, and develop an action plan that includes like the design and implementation, and possibly, down the road, measure the success. Was it working? Did it not work? Things are changing all the time with the government regulations. So we kind of just want to have that person possibly in that health and safety committee that I spoke about earlier to just kind of track and mitigate all these little changes. One thing I always tell, because I get a lot of questions from employers, and one thing I always say is just simplify it. Like, look at your engineering controls, look at your administrative controls, and look at your PPE. In the health and safety world, PPE is supposed to be your last line of defense. Right now, we are going right to PPE. So when you look at, Bernie was talking about the cubicles, you know, we see a lot of plexiglass being put up to kind of box people in and then avoid kind of wearing masks all day, because they do put, you know, a little bit strenuous on your cardiopulmonary system. Administrative controls can include anything from applying a new policy. You know, we know that everybody congregates in the lunchroom, right? So maybe we're going to do staggered breaks, and this is a new policy that we, you know, implemented into our business. And then of course PPE, you know, you try your best in what you can get. There is a lot of fraudulent N95 masks out there, and, you know, like things coming from China that aren't Health Canada approved. So you just want to be aware of that as well.
Great, thanks, Robin. I'll jump in. I wanted to maybe Deanne, you could weigh in a little bit on the requiring your employees to wear masks. So in this whole conversation, is that actually something that you can do? I know some employees may have concerns around that. Maybe you could touch on that from an HR perspective.
I think it always comes down to what the rationale is, just like anything, whether it's a bona fide occupational requirement, or in this case, whether it's an actual requirement that's needed to protect yourself and others in the workplace. I think as long as you're explaining to employees why you're doing it, like Bernie did a great job talking about the elevators, why we have an occupancy limit, why we would require you to wear a mask in the elevator because we can't distance enough, then I think those are reasonable asks. Always though, communication, as you've all said, is key. If for some reason an employee can't wear a mask, maybe it does exacerbate a pre-existing condition or something, they need to feel comfortable having those discussions. And in those cases, employers just need to be prepared to discuss accommodations. So if I can't wear a mask for some reason, perhaps I get to ride in the elevator by myself, and we accommodate that in the workplace. Those are very reasonable discussions to be had. And the most important thing from my perspective in HR is just that you're creating a corporate culture, as you all have in Fort McMurray, where people understand that your safety is the concern, and that you're willing to talk about things, and that you will communicate with people if they come forward. Everybody's a unicorn in these situations, is what we keep saying, because they've all got different situations themselves, different situations at home. We're having discussions with people that typically we wouldn't have tread into in the past about their potential, you know, medical conditions or whom they're living with, things like that. So those discussions and having them respectfully but openly is key, and facilitating them and encouraging them. But explaining where you're coming from is key, because usually when people understand why you're doing what you're doing and that it's for their safety, they're willing to comply and or talk to you privately if they have concerns.
Deanne, there has been you know, a great indication that there's been lots of fear surrounding employees coming to work. Aside from communication, what do you see as kind of the main way that employers can support their employees?
Yeah, there's been so much discussion around mental health. We're being isolated at home as people have been asked to work from home, and a lot of people didn't adjust well from having to leave the workplace. Now we're recalling people, and some of them don't want to come back, and they have fear about coming back to work. Communication has to be named again, because reassuring people that you as an employer have taken all the steps that we're talking about, like everything Bernie's doing is good, making sure that employees know that that's been looked at, so they have comfort that an employer is being responsible, that they are taking this seriously, makes a big difference. My team works at a lot of different client sites. So as we've kind of been reintroduced into the workplace, that's what we're doing, is checking with each employer to see what they've done if we weren't intimately involved. And some of our clients have been holding weekly calls leading up to the return to work. The president in one case is having a call with staff every week, letting them know what they're doing, how they're preparing, what the protocols are going to be when they come back. And that goes a long way towards mitigating anxiety of employees. If they know that you've done your due diligence, then they don't feel the need to go online and do their own research and start looking at those news articles and things like that, which obviously we want to keep them away from. Robin mentioned keeping it simple. That's important too, but they need enough information. It's also important, I think, at this juncture, if you have an employee family assistance program included with your benefits, to highlight that for employees. So if they are feeling general anxiety, some people have, you know, actual medical conditions. Other people are just really worried that they have someone to talk to, be it the safety rep to talk about the factual protocols, the HR person to talk about, you know, maybe they have concerns about their job and what it means if they can't come back to work because their child's daycare is closed, all those different things. And then that they have a qualified person to talk to through an EPAP program if they do actually need to talk to someone about their mental health. So those are all things that employers can do, communicating themselves, but then recognizing that sometimes it goes beyond what they can talk to and that, you know, they need to refer someone elsewhere.
Awesome. Thank you.
I just think that kind of lends well to sort of the other end of the spectrum, which is more around complacency and compliance to the rules. Tim, maybe you could weigh in here on complacency. Seems to be an issue in the population, and it's becoming increasingly, people have been becoming increasingly comfortable in the public environment. So you see that people aren't really wearing the mask when you're expecting that, etc. How do we avoid this, and what would you comment are some strategies for encouraging ongoing adherence to the provincial guidelines?
Yeah, it's a great question, and thanks for the invite to provide some input into this great conversation. For me, I think I heard a great term the other day. Instead of PPE, it was PPB, and it was personal protective behavior. And I thought that was a great balance to what we have to. So COVID is a biological hazard. It's been identified before. It's a hazard that it's part of risk management. You have to have procedures and practices in place. Did we have all the practices in place specific to this type of challenge? Not fully, based upon my past experience. We had some dips into SARS and other, but we've dealt with influenza pretty much forever. So we've always had those challenges within the workplace. This area around compliance, to be in a region in Fort McMurray is probably one of the better places to be, because we've dealt with quite a few challenges in the community, from fires to floods to boil water orders to what we're currently facing with, and we understand the principles and the concepts of compliance and the importance of fulfilling rules are in place to protect not only us but others. What I'm seeing lately, though, on the complacency side is a little bit around the re-entrenchment back into opening things up, and your comment around you're not seeing people wear masks. I think that there's, it goes back to the education and communication, not only at the workplaces, but in the community itself, that this is important for us. We also need to understand that there's different challenges that we may not have had before as well around this, around mental health and what people are dealing with. To Bernie's point earlier, people aren't consciously saying, I'm going to break a rule. They may have things on their mind. There may be a whole bunch of other factors that you're not aware of. So you have to take each situation and really understand what's driving that behavior, and being supportive and not being necessarily aggressive, and some things that we see down in other parts of the country or the world around some of this. So it's really around, how do we support each other through this? How do we ensure that there's great communication of why this is important? And it's a balance between a rule and compliance and hearts and minds, and wanting to do it for the right reason. And for the right reasons is for yourself and for your family and for your community and such. So I really like that PPB approach. Is it's not only wearing the PPE, but it's also, what are your behaviors that you're doing to protect yourself and others? So it's really around education, communication, making sure the support systems are in place. What I'm hearing so far on what companies and organizations are doing in the region specifically are great, because it's really opened up the lines of communication between leadership right down to the front line. So
awesome, thank you. So Bernie, I'm going to ask you, what are some of the things that maybe in your initial assessment that you felt you may have overlooked in the beginning. And then once people started to come back, you're like, hey, you know, we never thought of that. Now that the economy is reopening, I think people in their first steps are saying, okay, you know, we've got masks, we have hand sanitizer, we have some things here. But what were some of the things that maybe you didn't think of initially that people may overlook?
I think we were fairly fortunate, I'll be honest, because we did have weekly meetings with our employees, and we had Skype meetings every single week with our workers, and we had leadership meetings every single day with respect to COVID. So as we were getting questions in, we were able to either answer them that day or the next day. I don't think that we were really found anything that we weren't truly prepared for. The lack of personal protective equipment, the lack of hand sanitizer, that was a shock to us when that first happened. It was worldwide. And so, you know, we had people that were asking us, is Boucher going to supply us with an N95 mask? We couldn't physically do that. It just weren't available. So that was something that we weren't prepared for. We addressed that concern with the cloth masks that we supply to all of our employees, and we wash them every day and things like that. The amount of anxiety from people when they were coming back to the office was a bit concerning to us for some people. So what we did is when we made the announcement, we did it a week beforehand. So it gave people a bit of an opportunity to get used to the idea that we're going to be coming back. And what we also did is we had a brand new orientation package for them. And we sent that out to them and let them, to their personal emails, let them take a look through it. That included pictures of what we had done in the office to ensure their safety and to make them more comfortable. And lastly, we actually met them outside. So as people, we did a staggered reentry into the office. So we brought 2-3 people in at a time, a couple days apart. We brought them in staggered. So their first week, they maybe worked Monday, Wednesday, Friday. The next week, maybe Tuesday, Thursday, and then the third week, the full week, to get them time to adjust to. I mean, a lot of people have small children at home and they've been home with their kids for 3 weeks, and to make that adjustment. So there was the level of anxiety, I think, was the biggest one that we weren't really, it's not that we were unprepared for it, but it was there for our people coming back to the office.
Yeah, and just to add to my comment earlier around the preparation, we're prepared with the processes and protocols and all that stuff for this. I think that is the biggest challenge that we've faced so far, is the mental impact to employees, not only ones that continue to work and do reduced workforce that's maintaining the facilities and keeping the companies running, but the virtual aspect of it and the social in a sense isolation a bit, like Zoom and Skype and all these FaceTime and all these types of social platforms have been beneficial to keep that connection. But people are, especially over the springtime, where we're very much isolated within their homes. So the mental challenge, or the challenges on people's mental state, has been probably the biggest challenge we've never seen before. We had a little bit of a taste of it within the fire when we evacuated for the fire and coming back, and there was some challenges around that. But I think this has really provided. Unfortunately, the situation is the way it is, but it's been good in the sense that I think the mental support that we're providing employees and emotional support that we're preparing for reentry as well as ongoing has been very beneficial. I think there's a lot more communication that are going on, and there's a lot more maybe practices that had been in place with leadership having, like to Bernie's point, daily conversations. I know within our organization we have a conference call a conference call with all of our employees every 2 weeks. Our leadership talks about what are the steps they're taking, what's happening, what are the next steps, both on our business side, but also within our own structure. So I think that has probably been the biggest challenge for me anyway, that I'm seeing in the industry, is around the mental health of workers, and a little bit of people having, I was just trying to think of what it's called, remorse, like they feel bad that they're not at the workplace and they want to get back. And there's going to be, I think, the other challenges when we get back to re-socializing with the workers together. There's going to be some challenges as well. And how do we keep that going?
Thanks, Tim.
If I could just make one comment, just on the compliance piece. You know, anytime we're talking about compliance in the workforce, it's whether people will comply because it's required to comply and there's maybe a supervisor there. But our goal is to have people comply because they want to comply. In order to do that, we really have, what's in it for them? We have to show people what's in it for them. And if there's a value to what we're doing for the people that we're dealing with, then we'll get compliance. So one of the things that really worked well for us as far as compliance goes, because we did have different ends of the spectrum. We had people, we have people from all over the country that work for us. We have people coming from small Indigenous communities. Northern Saskatchewan was a huge challenge for us. But what we did was we did a couple of comparisons. It was ironic because about 3 weeks before Dr. Henshaw had done the comparison between Alberta and Sweden, we did one. And we showed people exactly where we might be if we didn't take the steps and measures that we took. And that kind of really opened up people's eyes because that would have directly affected our Boucher family. With 1,100 employees, we would have had a heck of a lot more exposure and potentially deaths from COVID-19 if the measures that we and steps that we take if we didn't do that. So I think it's really important that, and again, to Tim's point, that open communication, that education, that strong message, and what's in it for the people, right?
Thanks, Benny. We did receive a question from the audience. So, and I'll read it out and we can see who fits best. Feel free to jump in. Employee vacation is a concern. We want our team members to get away and rest and relax, but we're also concerned because we're only relying on the education we have done and employee behaviors to protect our business. I have been surprised by how many people are willing to travel now that things are opening up. I think this kind of lends into the second comment from the same person, which was with the rising cases in Alberta and things opening up, we're feeling like we're at the highest risk now versus when it all started. I'm not sure if Deanne may want to jump in on a HR perspective related to vacations and,
Sure.
and what you can do in there.
On the vacation side, I think the part I'll speak to is the need for people to have mental breaks. So we've talked about working from home and how we're using technology to connect now, and things like this are great, but we've also heard new terms introduced into our lexicon like Zoom fatigue. I don't know about you, but in the beginning I was keen to get on with people on Zoom, and then you realize eventually that it does take its toll. And you miss the old-fashioned phone call where you can multitask and do other things and not have to be looking at yourself on the screen. So people are dealing with more than they've ever dealt with in the past. They're trying to work from home. They've got their kids at home. They're juggling so many different things. So it is important for people to have downtime. So whether that's taking a few days off of PTO or whether they want to take a week, I'm off next week and we're actually going camping, my family. So we're lucky that we can do that. And we're going to go into the woods where no one else is and just have that downtime. And it feels long overdue because the last few months have been so intense, keeping up with all the legislative changes and the programs and everything. Our clients have been busier than ever in a lot of cases. And so I think it is important to encourage people to use that. You also have to watch, because depending how long things go on, people are accruing vacation, and sooner than later, you've got a whole bunch of people who need to take a whole lot of time off. And as you all know, it's your responsibility as an employer to ensure people are using their vacation. And if they don't have an opportunity, then you need to schedule it. So you don't really want to end up having to do that. You want to work with people to try to find opportunities for them to take time off, but also being respectful that they may want to hold back until such time as they can actually take a real vacation. Not everyone wants a staycation. Not everyone's into camping. So again, opening up those dialogues, talking to people and saying, look, we want to be sure that you're taking time off. We want to be sure you're taking care of your mental health. We recognize, though, that things are different. So let's talk about what you have in mind that you might be able to do and when you could schedule your time off so that you can ensure coverage and you don't have a bunch of people trying to take time off or a whole lot of carryover. That's what we're thinking of from an HR perspective. The travel piece, I'll let you all speak to safety, because obviously if they travel out of province, then when they re-enter, you've got a whole lot of safety protocols that you have to think about, and I'll leave that to the safety experts.
Did anyone else want to make a comment on that, on how you're dealing with employees who want to travel out of province and returning to work?
Well, I think it's just important that the practice has been pretty much stated, even at the beginning of this, was around isolating or self-isolating yourself after you've been somewhere. When we saw people coming back to Canada when this first started and self-isolating, I think it continues to be important that people understand that although the weather's nicer, it was easier to be isolated in the wintertime or in the spring because I didn't really want to go outside, but now people are wanting to go outside. We're seeing the relaxation from the province and nationally on people's ability to get out and go to restaurants and such. So I think it's really around trying to keep the urgency and the importance of your behavior regardless of the situation, because the situation that we're currently in potentially could last another 12 months when you start to look at, you either have social or you either need a vaccine or herd immunization to really get this to the next level. So we really do need to prepare ourselves, because if we there's comments around this, we haven't even, we need to prepare for the second wave. I think we're still in the first wave that could get bad if we don't really be conscious of our behavior. And it gets more difficult as we start to open things up and you see more people going out there. So I get, it's more education and reinforcement that regardless of what your activity is, you have to be conscious of the hazard that is out there related to this.
I'll just
Thank
quickly
you.
add, because I think if you have employees that are traveling internationally, like you would have to be notified because they will have to self-isolate when they re-enter the country. So you have to make some stipulations of can they self-isolate it and work remotely for those 2 weeks, and think about things like that for people who plan to leave the country. So.
Vanessa, at this point, Alberta is not imposing isolation if we're traveling within the country, though. Is that correct?
Correct. Yeah. There's only 2 provinces that are requiring, or 3 provinces that are requiring that currently.
Okay. Awesome.
Thanks, Vanessa. I had another question I wanted to pose to the group, because I know we've mentioned a few times setting up your safety committees and access to the benefits and all these things. And I do know that there's a lot of small companies in town that don't have safety experts on staff and that type of thing. So I was just curious if you guys knew of any or could share any resources that you would recommend some of these smaller people can connect in with. Vanessa, maybe you could add. I know the Biz Connect is one area, but without those safety committees and departments, as a mom and pop shop or a one-man show, do you have any advice on where they could go to educate themselves and put things in place?
Yeah, well, I mean, yeah, Biz Connect is a really good starting point for the mom and pop shops, like everything I said, like the signage and stuff like that, so they don't have to reinvent the wheel. I think that's really important, that people have the conversations and share information, because this is a first and no one's ever done this before. So sharing the information is very, very important. And again, let's not reinvent something that's working somewhere else. On the Biz Connect website, or if you go onto NATE's website, they've actually put out a document, a re-entry document, and it's really, really good. The guy who developed it has done emergency management for a very long time and is a specialist in it. And they can use that document, and it's everything from your physical building and how to restart it and reopen it to bringing back your employees and some things that you need to think about there. So that's on the Biz Connect website. It's a good starting document for organizations also.
Awesome. Thanks, Vanessa. I did receive a question as well, and it's about people who are sharing offices. So if long-term you have an office mate, would it be an expectation to wear a mask while the two of you are in an office together if you are if the door can be closed? So, in my office, for instance, is a shared space. There's more than one organization in there currently. If 2 people are sharing an office and between the 2 of them are comfortable not wearing masks, what would your comments be on that for somebody who long-term, they're going to be in that space with each other regularly? I don't know who wants to take that one, but.
I'll just kind of add a little bit of an OH&S perspective on that. And in my mind, that would not be acceptable. We would not accept that, to be honest with you. And the reason why is because although those two people may feel comfortable, it's more than them. It's the people that they're going to affect when they're out in the public. It's the contact that they have with people when they are out in the public. In my mind, the regulations and the rules that came from Alberta Health Services are pretty clear. Social distancing or physical distancing, and if we can't do that, we need to protect ourselves in another way. That's part of a hazard assessment. We've had that question as well with people that say, well, they're in my bubble, right? They're people that are in my bubble, and when we associate off the job site all the time, so we don't need to have that physical or social distancing in the office. And we say to them, this is not at home. This is not the barbecue. This is a workplace. We have an order from the provincial government, from Dr. Dina Hinshaw. It's very clear, and we would put it in that respect. Tim, I don't know if you want to jump in on that.
No, that's exactly the right approach. We do these hazard assessments. We get direction. We follow the rules, and that's the challenge of as we start to open up and re-entrench ourselves back into the workplace, that it goes back to that behavior, that personal protective behaviors that we need to really start to emphasize with the workforce, is that although we can't control people's behaviors when they're out at home, and we do want them, we hope that they take the same approach at home as they do at work, and really start to manage and understand the hazards. So the rules weren't just developed to satisfy someone's perspective. There's a lot of research and there's a lot of thoughtful experience gone into this to say these are the rules, or not so much rules. I hate to say rules. These are things that we need to do to protect ourselves, regardless of their rule, a protocol, or a behavior.
I have a comment and a question back to the panel. So comment-wise, we do work with some smaller clients, and in a lot of cases, they just don't have the space to accommodate. They don't have enough offices, and they are in small workspaces. And in most instances, what they're doing is doing gradual return to work in shift. So half the office will be in one day, half the office will be in the other day, or whatever they've worked out, because they don't want to put people at risk for the same reasons that were just mentioned. And so that's how they're accommodating it, but also giving people the respite from home if they want to be in the office and kind of work something out there. And then while you were talking there, Tim and Bernie, a question occurred to me, and that's, I worked at Finning and ATCO in the past in Fort Mac, so I'm thinking of the people that have to work in the trucks in teams. How are you handling that with fleet management? Does anyone come across that yet in terms of needing two people in the vehicle sometimes for safety?
Yeah, our policy is most certainly two people in a vehicle at a time, one in the front, one in the back. The driver.
Okay, so the cabs are big enough. Okay.
Yeah, and then as well, again, we have to wear the masks while we're in the vehicles, even with two people, because we can't social distance or physical distance within the vehicle. Most of what we've seen has been participation and compliance with respect to people because they want to. But we have had times, I'll be honest, when we've had to use occupational health and safety and say, hey, look, you know what? You're going to comply with this. And it's unfortunate when we get to the point where we need to order people to do things for their own benefit and their own health and safety. We've had to do that very, very little, but there's been a few instances where we've had to be firm and stern.
Well, and I think that goes back to even before this, you have people that have high risk tolerance and people that have low risk tolerance, and your systems have to accommodate everything. And that includes even the HR systems and understanding what are the not so much enforcement, but if people aren't complying, what are your processes? It shouldn't be any different than any other type of incident that a person would be involved in. But granted, you still have to take that extra step, I think, nowadays to understand, even in a non-COVID related non-compliance to an incident, is really understanding that medical or mental health situation with the worker, and really asking maybe a few more questions than we traditionally had in the past, and really making sure that they didn't knowingly non-comply versus my head wasn't in the game today because I got all this other stuff either at work or at home going on.
Yeah.
That's great. Thank you both for that. We did receive another question, and I'm not sure if Robin, you want to take this one. Is the temperature check required or something that's recommended at this point for employees to check in? I know at daycares they're doing temperature checks. So any comments on the temperature check for employees?
As far as I know, it's not like a required thing. It's basically just part of the main, when Alberta Health Services came out and, you know, we were doing all these employer-employee health checks and screenings. You piece everything together. You got your health questionnaire, you got your, you know, temperature checks, and then you have, you know, whatever else that they instilled, but temperature checks aren't like mandatory. As we do them here at my clinic for everyone that enters for drug and alcohol testing or any type of testing. We do a full, we have a stop station. You must put hand sanitizer on before you come in, or you can wash your hands for the 20 seconds with soap and water. You fill out a questionnaire. We'll do your temperature check. It's just an added piece to help ensure that we're doing our part as a business as well. So it's not mandatory as far as I know. It's more of just like a pre-screen basically.
Awesome. Okay, thank you. If anybody else on the line does have a question, by all means, please enter it into the Q&A box there. As panelists, is there anything that you feel that we may have missed or information that you would like to share from your perspective to employees or employers that may be on the line to say, you know, just think about this, or, you know, you're doing a good job. Is there anything that we've missed that, you know, you feel is very valuable information that should be shared at this point?
I'll just throw in that, you know, under some of the guidance, if you do have a lot of people coming in and out of your business, or if you have employees that are coming in and out, you might want to keep records for every 2 weeks of people that are coming in and out. If there is an outbreak within your organization, then you're able to track the people that might have been affected. I know for some facilities it may not be possible, but it is a consideration in your hazard assessment of, is that possible? Can we do that? Are we able to keep those records? Some facilities it will be mandatory, like recreation facilities, for them to keep those records. So as a business, it might be something that you can think of.
And I'll add in, sorry, Tim.
No, go ahead, Dan.
I was going to say, Bernie alluded to having one point of contact to answer questions and be an expert. I think that's a great idea. Coupled with that, I think it's important to have an internal FAQ for supervisors and managers, either letting them know where to go to or talking about how to answer questions employees might have. A lot of employees want to know if they have to quarantine or self-isolate. What's the difference? Are they eligible for CERB? How will your payroll group handle it? Is vacation going to be utilized? And depending on your own internal policies, some of those things could differ at different employers. Others are obvious directs to the Alberta Employment Standards, things like, you know, the new unpaid 14-day leave that people are eligible for, things like that. Just good to have your own little internal FAQ circulating to make sure everyone's on the same page and giving out the same answers, especially if you don't have one point of contact already identified.
Awesome. Tim?
Yeah, just a couple things that are probably on my radar as we start to re-entrench is due to the isolation, a lot of people have been at home, of course. That work hardening and getting people the physical demands of going back from a sedentary type situation to more, you're not, it's like a hockey player on off season. If they're not keeping up their skills, they're a little rusty when they get back in. I think we need to make sure that people need to understand that they can't go back 100% or shouldn't expect themselves to be back 100% when it comes to the physical capabilities. And we need to make sure that people are aware of that. But also on the mind on task and making sure that there's a lot of checks so that your field level hazard assessments and risk assessments that you're doing and having those conversations prior to starting work are done even probably more to make sure and health check in with your work team before starting work and making sure that everybody is in there. So it's really around that physical capabilities and then the competency side. If you haven't been welding for the last 3 months and you're now going to start welding. It's making sure that you're understanding that those skill sets may not be at the peak they were before this.
That's a great point. And I would say that would be something that lots of people might not think about. I know the opposite happened when we first were off work and everybody was at home in non-ergonomic workstations. Our backs were sore, our necks were sore, and until we were able to adjust and prop things up and get some chairs and things at home. But yeah, going back, especially if you're in a labor intensive job and you haven't been working, it's kind of like a weekend warrior, right? You don't go run a marathon your first time out. So I really appreciate that point. I think it's a great one. Anyone else have any comments that they'd like to make? We're about time to wrap up. Oh, we do have another question here. A comment that employers should ensure their employees stay home if sick. Yes. So I think that's really one of the difficult situations, and a conversation that I've had many times too, is when you wake up in the morning and you think, oh, I'm not feeling great. Are you not feeling great? Did you have a bad sleep? Do you just need a cup of coffee and a glass of water and you'll come around? I think lots of times people go to work and then all of a sudden they think, oh, I don't feel good. And then they've already been in and around their fellow coworkers. So how should employers be, communicating what the expectation is? I know that we say, if you have those symptoms, to stay home, but people are worried about paying their bills. They haven't been at work for months. So, what does that conversation look like between an employer and employee to say, don't second guess yourself. If you're not feeling good, stay home? And I don't know, maybe Deanne, if you want to take this one.
Yeah, I was going to say exactly what you just said. I guess we have to recognize there's a difference between employees who are able to work from home. In that case, I think it's a little easier. I would say if you wake up and you're not sure, notify your employer that you're going to be working from home that day, and at least half a day until you know whether you're feeling better or not. And employers having the ability, that's one of the nice things now that we've all been remote working, a lot of us, is you have that set up and you have that ability. So why not let people utilize that if they aren't sure until they are? If it's someone who needs to come to work to be on the tools or do physical work in the workplace, it's a little trickier. And in that case, encourage employers to just consider what flexibility they can give. I think it is important to keep people off the work site if there's any doubt as to whether or not they're sick, and how you accommodate that as an employer is up to, I guess, your own policies and procedures. In Fort McMurray, I know for recruitment purposes, there's usually a lot of PTO and things like that. And hopefully there's some shift flexibility. That's not always the case. So ultimately, if push comes to shove, we would recommend that you prioritize safety and you allow someone to stay home and either take advantage of, if they end up being sick, the CERB program or something like that, and just go to your core values, right? What are you really focused on in the workplace? But you do need to have conversations beforehand. That's one of the things, to be sure that you're ready to answer those questions. So you don't have a supervisor telling people they got to come in no matter what, because we don't want to lose time, and that everybody's on the same page.
I think on the resource side, all companies have to have a WCB account and as part of business. Usually that WCB account is associated with right now, I would say the majority are assigned to a safety association. There's a premium that's paid to safety associations like Alberta Construction Safety Association or Manufacturers Health and Safety Association, ourselves, Energy Safety Canada. I would encourage people to find out who their premiums are going to and find out the resources that are available in that way. So there are you have access to resources and support within just ourselves. Within Energy Safety Canada, we have tons of information around COVID and practices from CCOHS to webinars on mental health, and supervisors. ACSA has similar ones. So there's a lot of information that's out there that people can get access to and reach out. Locally, there's a Wood Buffalo Regional Safety Committee that we meet on a quarterly basis. There's a lot of support within the community if people are struggling, at least to get some guidance.
And would you share that information with myself and Michelle, maybe on this committee you're speaking of?
Yep, absolutely.
That'd be great. Thank you.
I just had a couple comments here. Two of the things that we found that were really, really important to us was, one was a disinfection plan. as actually a document that how are we going to keep things safe? How are we going to keep people safe? How are we going to make sure that common services are cleaned? So that laid out disinfectant plan, including pickup trucks and transportation. The second piece for us was very important, was a pandemic response plan. A lot of people say, what if? What if my coworker gets it? What if, how am I going to get home? Is, you know, do I take a taxi? Do I have to go to the hospital? So that pandemic response plan is a very important document. It was a very important and is a very important document for us. So those are two of the key documents that I think are very important. And just lastly, we're introducing a lot of new rules to people, a tremendous amount of new rules, and we're being very diligent in enforcing these rules. We really need to recognize good behavior. We get a lot more with honey than we do with vinegar, and we need to recognize people that are out there wearing the masks. Thank you so much. I can see that you're doing some social distancing today. And that positive reinforcement, we actually do a little bit of rewards for our people. We have a little bit of a reward program where we might give away a coffee mug or something like that, or have somebody speak up at a weekly meeting or something like that with respect to this. So I think it's very important that positive reinforcement, we really get a lot of good buy-in when we do that. Thank you.
Awesome. Thank you, Bernie. We don't have any more questions. Does anybody have anything else they would like to comment before we wrap up? I'll throw it back to Natasha to do a wrap up.
All right, I don't see any more in the Q&A box, and we're 18 minutes over time, so really appreciate everyone's time. And thank you so much for participating. I think it was a really great conversation. I'm sure that people got a lot of value out of it. For anyone on the line, we did record the session, and we will put it on our website on wbcentral.biz. That's also another site that you can go to and look for resources. That was a collaboration between a number of the stakeholder groups in the community that support the business community. So please feel free to check that out. Otherwise, that is all from our side of things. Thank you so much. Thanks, Michelle, for co-hosting with me. It was great to have another person on the line. And thank you everyone for your time. We'll call that the end.